I have always liked going fast. I was a fast talker, and growing up in rural Alberta, I picked up the fastest sport around, barrel racing. When I moved to Edmonton, I also began playing hockey. At work, as an educational assistant with kids who had a brain injury or speech challenges, I was forced to slow down. At times, it was hard working with these kids. They would fall on the floor and have tantrums because they could not say what they wanted or just could not understand what was being said to them. As their EA, I understood their frustration, but I definitely never expected to be in the same situation as them. 6 years ago, I slipped on some ice and hit the back of my head very hard and suffered a brain injury. As a result, I have a fluent aphasia, hearing and visual problems. For 2 years, I spent my days doing therapy. Everything was just too hard to cope with. Losing my ability to speak and the vision in my left eye, not being able to concentrate, 90% hearing loss, and a swallowing disorder. The tests, procedures, and diagnoses just kept piling up as I spent a lot of time in and out of hospital. I eventually got hearing aids and with therapy regained the ability to speak. But my diagnosis meant that I would only be able to understand about 50% of what was said to me, and I would speak like I had an accent for the rest of my life. My aphasia gets worse when I'm sick. I have to use an iPad to speak with healthcare staff, and often they do not know that I can lip read. It is interesting what people will say when they do not think you understand them. One time, I watched a conversation where one nurse asked another, "How is your day going to be?" And she responded, "It should be okay. I only have 3 patients and one of them is an idiot." Another time, as my speech therapist was telling a neurologist that I was starting to coach hockey again, he said, "What does she do, pass notes?" All these little negative interactions hurt my confidence badly and set me back in my recovery. I began to truly understand the kids I used to work with, but I could not just drop to the floor and have a tantrum to let my emotions out. So I decided to write a letter to the Minister of Health. I explained how people with communication disabilities have the same rights as people with physical disabilities, and that things could be done differently to care for them. After that letter, I started to speak to healthcare providers at conferences and meetings. Over the last 2 years, I have been advocating for the communication access symbol. I hope that soon all patients with communication challenges will have the symbol attached to their healthcare file. This would result in a more positive healthcare experience, not only for patients, but also for staff.